Hi everyone, this is part 3 of the IRB application overview for DNP projects at the New Mexico State University using the Maestro review system. And so we're continuing on here. We've already talked about the adding your name and your committee and how to upload everybody's IRB certificates, all their training certificates. We've talked about the difference between expedited and exempt categories, and how you'll at least take a stab at figuring out which is going to how your review is going to be how your application is going to be reviewed by the IRB. If you have questions again about the difference between exempt and expedited, talk to your chair. If they're not sure, feel free to reach out to me, or you can actually call the IRB and ask one of the staff people as well too, or send them an email with a little bit of an overview of what you're going to be doing. So this part here, as we kind of move down, you are going to enter, again, if you have another phone number, you don't necessarily have to add that there, but that's a possibility if you, so additional author information. Now you've listed all of the individuals on your committee up above. If there is someone in your organization who is really contributing to your project, and if you were to publish the paper that comes out of your project, they would be an author, then you can add them here. You can also add them later, at a later date, so that's fine too if you're not sure. If your research is being done at a non-NMSU institution, which for all of you this would be the case, almost all of you, you're going to list the name of every person who really is going to be involved or collaborating with you. Now, if you are doing this on your own and you've gotten permission from the nurse manager, the CNO, or the medical director, they do not need to be on this IRB application. However, if they are actually going to be looking at data with you, helping with data collection, anything like that, then they need to be listed. And so I have a few people here who are listed. These are staff at Gerald Champion Regional Medical Center in Alamogordo. And so I listed their names because they are actually going to be doing this project, and I am consulting with them, and I've listed the institution for, and if it was different institutions that you're working at with different people, then you'd have to list the name and institution for each person. If anyone is going to be involved in your project, especially collecting data, consenting individuals, looking at data, collecting data for you, then they are actually going to have to do the city training as well. So they would have to upload their certificates. Now there's no place to upload their certificates here, but at the end there's a place where you can just upload other documents, and you would upload a copy of their certificate to attach to the application. Okay, it's asked, is this a renewal application? And you would say no. If this project takes more than a year for you to complete, then you will have to do a renewal application, and it's basically just you provide an update of what you've done and then your timeline for completion, and then in that case it would be yes. Conflict of interest. It asks, do you have or do any family members have any financial conflict of interest in a business which owns a technology or a software or anything that you're involved in your project? In that case, you would say yes. Now, you would not, well, you would have to disclose that, and you would have to report that, what that relationship is. The key thing about conflict of interest, it's not that you can't have a conflict of interest, it's that it has to be declared, and then the university has to make the decision on whether or not they feel that conflict of interest is manageable or not. So I'm assuming most of you don't have a financial stake in what you're doing. However, if you had developed an app or some kind of IT system, and you own a business and you can actually sell this, or you're trying to sell it, you're going to market it in the future, but you're trying to evaluate the implementation of it at a clinical site, then you would have to put yes, because you do have a potential conflict of interest. And then there's some conflict of interest forms that you can fill in through the university system. Just get in touch with me if that happens to be the case. It's not that common. This next section says, just reminds you that everybody involved in human subjects research has to complete some kind of responsible conduct of research training. The best one, I think, the easiest one to work through is the city training, and all of you did that in Dr. Psyche's course. And there's links to it here as well, too. All right. So when will the research start? You kind of give them an estimate, and there's a big note here. It says no interventions or interactions with a living individual that can result in the collection of data can be conducted until IRB approval has been granted. So you cannot start your project until you have gotten IRB approval. You can't collect any data. Now, you may have collected some data for your organizational assessment, but in all cases, that was system level data like rates or costs. These are things that your nurse managers or nurse administrators, other administrators, compliance officers would collect, more aggregate data. Or, you're at a staff meeting and you're just asking about, what some issues are. You're talking to the medical director and they're saying, oh yeah, this is a big issue for us. You're not allowed to survey people without IRB approval, so that was not part of your organizational assessment. If you want to do a needs assessment, a formal one, you actually have to get IRB approval first. So we try to avoid that. Keep in mind that once you submit your IRB approval, there's a lot of things that you can be working on before you start implementing. If you have educational sessions, you can finalize your teaching plan, any teaching materials, handouts. You can organize your data collection form. There's a lot of stuff that you can do. You can write out your protocols. A protocol is not data collection. Get the protocol approved by the facility. Get feedback on things like that. That's not data. Data is going into the electronic health record and pulling patient files. Data is looking at, giving a survey, giving a test, et cetera, et cetera. So none of that can start, and really your intervention should not start until you have IRB approval. So give an estimate of when it's going to start. Give it at least 2 weeks from the IRB application, but the IRB submission date, but keep in mind you still can't go forward until you have that approval email. I would put at least a year on your IRB project. Hopefully you'll be done before that, but let's just we'll make that our general time frame. And then, so this next question here, number 27, what is the scientific purpose of this research? Now, here's the thing, the IRB application process and approval process was created for research. Our projects for the most part are, again, not pure research, although there is some element of research in a lot of them. And especially if you're going to be, collecting data or surveys or needs assessments or looking at charts. So in the end, that becomes human subjects data. So this question here, what is the scientific purpose of the research? Take out the word scientific. Scientific really just kind of points to discovery and research. So what is the purpose of this research? Well, you wrote a purpose statement. You wrote a statement that talked about the general purpose of the project, maybe an overarching goal, and then you had objectives. Put that here. So in this particular one here, I haven't quite fleshed it out, but I had two objectives to evaluate. One was to evaluate the effects of an evidence-based clinical pathway. And I use the word protocol because most of the people who review these are not clinicians. So evaluate the effects of an evidence-based clinical pathway on reducing the use of opioid and other narcotic medications in hospitalized adults following surgery for traumatic hip fractures. So there's a very specific, measurable goal. We sometimes call them SMART goals or SMART objectives. The other one is exactly the same, but with a different outcome. Evaluate the effects of an evidence-based clinical pathway on Medicaid-approved functional independent measures in hospitalized adults following surgery for traumatic hip fracture. So that is kind of the scientific purpose. I would recommend, if you have a more general purpose statement, to add that in there as well too, but certainly you want to have your clear objectives, project objectives. Now, down here, describe the background design and research methodology, time required for a single session, how many sessions, psychological or medical methods to be used. Again, this is very much research lingo. However, you have written a background section. I would not copy and paste your 10 to 20 page lit review here. You want it to just be a few paragraphs, or you could use bullet points as well too. So you could go in and talk about, maybe some of the evidence in your introduction to your PowerPoint, the significance, some of that, but then some of the key bullet points for your lit review, or go into your written lit review, the narrative, and copy and paste a few pieces of that to put it together. Basically, the reviewers are looking for evidence that you are not wasting everybody's time with this project, that there is a rationale for doing this project, and you know what you're talking about. So, if you're doing something that has no rational basis, no evidence, no research basis for this, then you should not be doing human subjects research. So you don't need you don't want a long background section, so you'll have to consolidate your background, your lit review in one way or another. Under design, again, we don't use the term design usually for quality improvement projects. So what I wrote here, it says, this is a quality improvement project designed to evaluate the effectiveness of an evidence-based clinical pathway involving a non-pharmacological intervention called PENS and a variety of patient-centered outcomes. And it should say on, yes, not and, but on. So I am saying, okay, this is a QI project, not really research. We're looking at the effectiveness of a clinical pathway. I've mentioned the intervention, the key intervention part of the clinical pathway. This is the one we're really interested in, this PENS intervention. And then I said, we will compare 12 months of outcome data acquired prior to implementing this clinical pathway to 12 months of data following implementation. So I'm saying, how am I collecting my data in a very broad way? I said, we are not evaluating the effectiveness of the PENS treatment on reducing pain since this research has previously been conducted. This project focuses on implementing this clinical pathway in a patient population that is high risk for opioid dependence and decreased functionality following major surgery. Outcome measures have been chosen to help the hospital determine if this pathway is effective in their facility and with their patient population. So I'm trying to use a lot of the QI language or the EBP project intervention language. I haven't described my sample yet. So the sample is in the DNP proposal PowerPoint template, we call this the population of interest. So that, in research language, population means the whole population. So in this case, the whole population of adults who suffer traumatic hip fractures and then undergo surgery in the world. Our sample is the sample that is going to be, receiving our intervention. They've been admitted to this hospital, admitted to this unit. That's the smaller sample. And so I would probably write something here like all adult patients admitted to this particular rehab unit, inpatient rehab unit that has had surgery for traumatic orthopedic hip fractures, something along that lines. And then I would include inclusion and exclusion criteria. A little bit on age, although age is covered. They really want to know about age down below, so you could leave it out there. Are there exclusion criteria? So, I certainly don't want patients on an LVAD. They need to be able to tolerate the therapy. There's things that may exclude people from the sample that I'm looking at to evaluate this clinical pathway. And so I would put anything about who's the focus. Now, in some of you, if it's a system level intervention and you're really just trying to get compliance among nurses or other hospital staff, then the sample would be the providers, the nurses, the physicians, nurse practitioners, etc. And that would be your sample. You may have staff and you may have patients. And so just describe everybody here. The setting, they want to know where it's going to be. And so just describe the actual setting. Don't be vague. Name the place. They want to know. Intervention. So again, I didn't quite finish this here, but I'm going to describe the clinical pathway in a little more detail. I'm going to describe the main intervention, non-pharmacological intervention. You are being asked to describe outcome measures. And so whether it is a survey instrument and a particular scale you're using, or electronic health record data that is going to help you determine rates of infection, readmission, things like that, length of stay, cost, those would all be your outcome measures. And then in terms of your data analysis, it may just be descriptive data, frequencies, means, standard deviations. You may be comparing pre-intervention, post-intervention. So in this particular one, we're looking at 12 months of data before implementing this new pathway, and then 12 months of data while we're implementing the pathway. And so we're actually going to look at some measures, again, depending on the level of measurement of the different variables. It may be comparison of means. In that case, we do a t-test if we just have those two groups. And there's paired t-tests if you can link your pre-test and your post-test data, which in a lot of these system level studies we don't do. So it would just be an independent t-test. Anything beyond that, if you have questions, talk to your chair. I'm always happy to help consult on statistics as well too, and Dr. Psyche as well. So. All right, so I'm just going to wrap this up here because, again, this is going to be, this number 28 is going to be the most important part of your application. So, location of the research. Most of these are going to be off campus. If it's off campus, you need to be very specific about where it's being done, and you're going to have to attach a copy of the written approval from an authorized official where applicable. And so the signed letter that you have gotten from your institution that we require will be scanned and uploaded as an attachment to the IRB. You should have some general estimation of how many people are participating in your sample. If you were going to look at chart data for 100 patients or 50 patients, then put 100 or 50. If you are going to be educating 20 staff and then looking at data for 50 patients, put 20 staff and 50 patients. If you are only looking at system level data and you're just getting aggregate data like, the monthly UTI or CAUTI rates, 3 months before and 3 months after, it's totally aggregate, then you can put not applicable, no subjects, as long as there's nobody that's you're collecting data from. In that case, you may be doing something with the staff, so then you put the number of staff that you're interacting with. Vulnerable subjects. If you click on this, you can see who the main vulnerable populations are defined by the IRB. So this does not mean vulnerable just in the general scheme of things. The IRB has a very clear way of defining vulnerable populations. The key ones for you are going to be children, potentially prisoners, pregnant women, and there are some other ones where you can just click on this list for a minute and go take a look. We can find this. Oh, is it gonna go? It's not gonna take us right there. You learned about this in your city training as, the key things, the key things here, children, pregnant women, prisoners, students. If there's if you're an instructor and you're doing something with your students, which again really doesn't fall in the DNP, scope that well, that they would be vulnerable subjects. Age of the subjects, I just said over 18 years. If under, indicate the ages, sex of the subject. Maybe not applicable. Here, ethnic background of subjects, you may be focusing on a particular ethnic or racial group because there's a health disparity. So if you are, then put that there. And then you're going to have to describe how you're going to recruit your subjects. And so you have to go into a little bit of detail here. Are you going to send emails, post flyers? Are you going to ask them people in person? Keep in mind, the key thing here, the thing that the IRB wants to know is that you are not being coercive. So he would be an example of coercion. You want to get the staff to participate, not just in your staff training, which maybe is required by the nurse manager, but you want to get them to fill out your forms so that you can get some data, some survey data. Now, you can't get the nurse manager to kind of twist arms or say, okay, it would be really great if everybody filled out this form and, you know, I'm going to take a look and see who did and who didn't. That would be coercive. What you would do is you would, you know, your approach to not being coercive would be at the staff meeting to say, you know, I'm trying to evaluate the effects of this intervention. Your participation in you know, what I'm proposing is completely voluntary, but if you're willing, it would be great. We'll give you a 10-question survey before the training, and then a 10-question survey after the training. Again, you know, it's completely voluntary. You do not need to participate in the surveys, but you know, if you're willing to, that would be much appreciated. So they want to know about that. Are you placing ads? Which probably not, but they want to know about letters, posters, brochures, and stuff like that. Again, you're unlikely to be using students, but we have that there because there's a lot of research on students that happens at the university, the psychology department. Let's just take a quick, okay. I am going to go ahead. That is kind of the general aspects of the application. The last portion is benefits and risks. So I'm going to go ahead and do that in part 4. And so we'll stop this video and we'll pick up on the next one.